which was really amazing. I mean, the work NHS is doing is incredible. But the United States, which makes up 27% of healthcare's global emissions, just committed to join the COP26 health program and align itself with the Biden administration's net zero goal, and to help set the global health sector on a trajectory to decarbonization. So that's incredible. We're so pleased to see the U.S. jumping into the game and HHS taking leadership on this issue. And please know, Admiral Levine, that Healthcare Without Harm and our Healthcare Climate Council, which is composed of 19 leading health systems in the U.S. that already have zero emissions and low carbon commitments, stands ready to support this, and that we'll be working together with the National Academy of Medicine and others to help implement this work. So we really look forward to taking this forward. The COP26 health program, as Dave mentioned, is an innovative collaboration, and that third part he mentioned is a collaboration between the UK COP presidency and FCDO, WHO, and Healthcare Without Harm. And we've been working really hard together over the last 6 months to try to get these commitments. And we thought maybe we'd have 10 or 15 at the beginning, and we're gonna have a big announcement on Tuesday of all the countries that are involved, and there are a lot of them. But so far I can share with you who's gone public with this. There were 18 ministries of health, national governments, that have committed to resilience and low carbon health systems as part of the program. Now there are 19 with the United States. And here's the others. I want to read you the list because it's important to hear the diversity of countries that are joining this. Argentina, Cabo Verde, Ireland, Jamaica, Kenya, Fiji, Lao PDR, Madagascar, the Netherlands, Malawi, Maldives, Mozambique, Morocco, Nepal, Sao Tome and Principe, Spain, Sierra Leone, and the United Arab Emirates. So that's amazing, and we're going to hear more on Tuesday. So that's just like... These commitments represent a huge ambition to transform healthcare. Now that ambition needs to come alive and be turned into action. So this is just the beginning. Implementation requires investment. It requires investment from national health budgets. It requires investment from health development assistance and the transformation of that investment. It requires climate finance, and it requires money from COVID recovery, all to help transform the health sector. Implementation requires leadership and shining examples of the possible, innovation, and much, much more. So fortunately, we have a growing number of shining examples to draw from. We have the NHS, which we just heard from, and we have the healthcare track of Race to Zero, which just last week announced the cohort before COP26. So we have 54 health care institutions in 21 countries, representing 14,000, or more than 14,000 hospitals and health centers that are committing to net zero. And this is in the midst of a pandemic. All of this is happening in the midst of a pandemic. And so from California to Kerala, from Sao Paulo to South Africa, from Newcastle to New York, we have hospitals and health systems moving to decarbonize. And that's just amazing. They are working on energy, buildings, transport, food, purchasing, all the stuff Nick was talking about. That's happening all around the world now. And implementing this commitment means that, but it also means a lot more. One slide. So it means decarbonizing and building resilience while achieving global health goals and universal health coverage. It's about investing in climate-smart healthcare in low and middle-income countries. It's about achieving climate justice with health equity. It's about doctors and nurses and healthcare workers demonstrating leadership in the workplace to transform those workplaces. It's about putting paper into practice. It's about putting these commitments into practice. It's about moving from ambition to action. It's about no less than thoroughgoing systems change and a huge transformation of how health is protected and promoted for all, and how healthcare is delivered in the 21st century. So we look forward to working with all of you to build this global movement for healthcare climate action in the health